And so, folks, you welcome to KMTV Live. We are at the Ministry of Health, where the MPHIL, Ministry of Health and Ministry of Information will be updating the Liberian people on the issue of coronavirus in Liberia. My name is Godfrey Bedokwansa. You can stay with us as we go through this press briefing. And so far, for now, in the House, we see the Deputy Minister for Information Public Affairs, Eugene Falcon, the Minister of Health, Dr. Wilhelmina Jala. We have Dr. Kete. So you can stay with us as we go through this press briefing.
Is also streamed online and repeat of this via television will be at 10 p.m. on Hot TV. So I'd like to encourage members of our police in the community radio sector to join us via LPS. The Deputy Minister for Press and Public Affairs at the Ministry of Information, Cultural Affairs and Tourism is our operation man, and we will introduce our speakers of today, press briefing. Mr. Bagon.
Thank you, Director Famole. Ladies and gentlemen of the media, good afternoon. Thank you for coming. I'd like to seize this opportunity on behalf of my boss, Honorable Eugene Nambe, who is not doing too well at the moment. I'd like to welcome you here to our regular Monday COVID-19 updates. Today we'll have with us the Honorable Minister of Health, Honorable Dr. Wilhelmina Jala, along with the Chief Medical Officer of the Republic of Liberia, Dr. Francis Kete. We will also have, we're told he is on his way, Dr. Masoka Fa, head of the National Public Health Institute of Liberia. Normally what I do is, this is the COVID-19 update. What we do is to allow the update to come first and foremost to you, and then after that, we'll do a little bit of housekeeping with some of the issues that matter most in some communities and around the issue that is very important. Today, briefing, as you know, we'd like to apologize for not bringing you the briefing the last time due to a series of high-level meetings taking place with the partners as it relates to COVID-19. And many of you may be aware that things have changed a little bit, and so without much ado, I would like to invite to the podium the Honorable Minister of Health, who will conduct the first portion of the briefing, followed by Dr. Francis Kete, and then hopefully we will have Dr. Fa arrive in time to update us with respect to the public health aspect. Dr. Jara.
Good afternoon, my fellow Liberians and all foreign nationals that are personally residing in Liberia. Since the last time we spoke to you all, a lot have happened over the last few days. We have gone to a state of emergency by the president with different category of things that are supposed to be happening within the confines of Monterey County, Mount Kibbe County, and the other two counties, River, Bantu, and Nima County. So today, first of all, I want to thank all of the Liberian people and all of the foreign nationals within the country for at least trying to abide by some of the restrictions that have been placed on you. We know that it's very difficult for people to keep social distancing from what we have seen outside, or people are very close to each other, or they are still doing some of the things that they were doing before. We want to thank you for washing your hands, so we have to give you credit for some of the things that we are doing, and then keep letting you know that COVID-19 likes for us to all be together. As long as we're together, the COVID is happy. The COVID does not know 3 o'clock from 8 o'clock in the morning. It's here at all times. So if you forget yourself and think that COVID is not looking, it's looking. When you go to the banks this morning, you see everybody on top of each other. Instead of some people getting bank cards, COVID is watching. When you touch a surface that somebody who have COVID and they did not wash their hands and they touch that surface, the COVID remains on the surface. If a person with COVID-19 sits in your car and they touch the surfaces in your car, and you go and touch those same surfaces and touch your face, your eyes, your nose, and your mouth, you are going to catch COVID-19. Let me say a thank you to those people who went for the testing, whether voluntarily or involuntarily. If you tested positive, we thank you for cooperating with our teams. Some people are still afraid, so they are running away. But we want to encourage you to not run away, because if you're running away, you will be spreading the disease. So please, if we call you and say that you are positive, please stay where you are. We will come for you. Don't start running, then we have to run after you. We don't want it to be a chase match. We want all of us to work together. Those who are taking a test and they are negative, we will do better in terms of calling to let you know that you are negative. If you are positive, we'll also improve and keep telling those who are positive that they are positive, and we are coming for they and the suspected cases around them. Please do not be afraid and do not run away. The sooner you get to the treatment center, the better for you and for your family. So please, all the people that were missing, the 2 people that we were trying to find, have been found. So there's no individual that have escaped from us that have been positive. We have found the lady from West Point, and we have found the little girl from the old room. So we have all of those people in our custody currently. A doctor called me this morning from a community in Johnsonville, and the people are threatening his life to say that he brought COVID-19 to their community. COVID-19 got on plane and came. So please, Do not threaten the people in your neighborhood, their lives, their family lives, because nobody is responsible for COVID-19. COVID-19 is a pandemic, that means it's in every country. So do not attack your fellow Liberians and saying that they got the COVID-19. We all have to work together. We all have to work in our communities to make sure that we find those who have been affected and we make sure that they are not affected anymore. One of the important things about COVID-19 is that we need to remain in our homes. If you have no reason to come out, stay home. And staying home doesn't mean you be in a neighborhood passing all around because they say that you should be in your neighborhood. It's better for you to be in your house. If, for example, all of us, we have food, we have everything, and we stay in our houses for 14 to 21 days, COVID-19 will go. But can we do it? At this particular point, I'm not going to speak for anybody, but I don't think that we can do it. And this is the way how that COVID will get kicked out of Liberia. We all have to make sacrifices. Something that we're not good at, we can do it. If we did it during the Ebola time, we can do it now. COVID is not like Ebola, so you don't have to worry about those things that happened during the Ebola time. For COVID, it's airborne, it's by droplets, so it's passing in the air. So you can't hide from it. Now, we want to first of all thank all our healthcare workers all over. Thank you. We are trying to work with finance ministries to make sure that you get some incentive going on so that you can be able to purchase your own food and other things. But we want to also make sure that you get to work. If you don't go to work, patients will not be able to go to the facilities and will be turning people away. We do not want any facility, public or private, to turn patients away. People have to go and deliver, those who are pregnant, people have high blood pressure, diabetes, asthma, and other conditions that need to be attended for in the hospital. But also you who are going to the hospital, you must be patient, because when you get there, they will ask you some questions, they will screen you before you go into the hospital. So don't just go away and say they refuse to take me. They have to go through a screening process. But we are working with the different facilities so that they turn no one away. They will be also checking for COVID, because checking in the sense of asking you some questions, whether you have a temperature, whether you have been in contact with somebody who has COVID, and other things, because the healthcare workers also have to protect themselves. But we want you to go to the facilities so that you can be taken care of. Recently, there were a lot of dead bodies. They're calling us here. Maybe they were calling before and maybe we were not all listening at the same time. But now we are listening. So if you have a sick person in your house, do not keep the person in the house until they die. Then you take them and put them on the street, or you start calling and say you got a dead body. If we can save the person's life because the person has other conditions other than COVID-19, please don't hesitate to call 4455, call the police, call or the ambulance, and they will come for your relative. But we don't want to see dead bodies all over the place, because people are afraid and they are dropping their relatives all on the street. So please, let us all work together. All the things that I'm saying, some are related to COVID, some not related to COVID. We have to have normal routine care We have to be able to take care of all those who have no relations to COVID. But we cannot take care of you if you stay at home and take small medicine here, small medicine there. We cannot help you. Maybe some people in your home right now have COVID-19. If you are treating them with malaria medicine, you giving drips in your house, you are exposing yourself to COVID. Anybody who's not responding to treatment, refer them to a facility. Nurses, doctors, other healthcare workers, please do not treat people in your home or in a corner because you do not know whether they have COVID or not. If they're not responding to treatment, you need to call your facility. The numbers will get high as we test, we'll get more and more people positive. We're encouraging you, if you have any of the symptoms, to go to one of these centers that we are using to collect specimen. This center is called a specimen collection center. It's only there to collect specimen. It's not, the test is not being done there. Once they collect your specimen, they will send it to the lab for the test to be done there. Again, we want to thank the police for the job that they are doing. Please look at people's ID card very closely. We don't have enough passes to give everybody in the country a pass. Then we're talking, even if you take one of the healthcare workers alone, all the passes will finish. Please look at the healthcare workers' ID card. It will say doctor, nurse, or whatever laboratory person. And if you see them moving at night, check their ID card. Don't stop them and detain them for hours or do anything else to them. Please, let all of us work together. Police, healthcare workers, all of us. Some people will be out, they will not have a pass, or you have to look at their identity. If you're not sure, you can call us and we'll help you to identify that individual that they need to get to a facility to help. So let the police, the military, healthcare workers all work together because we are all responding to COVID-19. We want to thank everybody, the media, the president, all of the Liberian people, Senate, everybody. We want to say thank you for cooperating, because without you, we will not be able to stop COVID-19 from overtaking Liberia. We do not want that to happen. We want to be ahead of the virus, but we cannot be ahead of the virus if the Liberian people do not cooperate with us. We are all on the same team. We are not on a different team from you. COVID is on a team by itself. The rest of us are on the other side. So if we fight, we beat COVID-19. Again, I say thank you, and let us continue to fight together and eliminate COVID-19 from the Republic of Liberia forever. Thank you.
Thank you, Dr. Jara. And members of the media, let me call on Dr. Masuka Fala, head of the National Public Health Institute of the Republic of Liberia. Dr. Fala.
Good afternoon, everyone. Thank you so much. All the support you have had, all this long marathon that we have started. In terms of COVID, there are two key issues. You must be able to test. You must be able to find the cases. And so we started to test. Yesterday alone, we tested for the mass samples. And of course, as we increase the testing and people are coming, the day before yesterday, we have 51 cases. And as of this morning, we have 8 new cases, making our cumulative cases 59. The good news about most of these cases, they were high-risk contact that we took to our precautionary observation center and they were tested and positive. We continue to encourage testing and we want to commend the Liberians, especially many of those. We have realized from our data analysis that 1 in 3 persons that have tested positive have voluntarily gone for their own testing, and we are encouraging that. People call us and say, oh, I don't feel good. I interact with people. We have a drive-through place at the SKD Basketball Stadium, and we realize that 33.3% of all the cases we are getting are people that go through the testing. And so that's good news. And we also have the news to announce that of all the cases that we have admitted in our treatment unit, over 36 of them, they are all doing well. 4 of them have now been discharged. The reason why I bring that question, I'm not going to speak on the treatment part, is for 2 reasons. We've seen for sure that those that come and present early for treatment, get tested and treated, they are the ones who are increasing our survival rate. Those we have to change our health-seeking behavior at Liberian because we tend to go for multiple treatment and then it gets late for you and then you grab dead. We're not saying that all of the death we're seeing today are from COVID, because one of the things we are doing is that we are testing all bodies to ensure. That's how we saw that of all the cases we had, there were 5 dead bodies that were positive. 2 of those, one of those was seriously sick. By the time we got there to take the specimen to test, he died the next day. The other one died in hospital. One was in Lima, and the other was in the community. We're very trying to encourage people to seek early treatment. The testing is free. If you don't feel well, rule out the COVID test. Go there and take your test. If you are connected with somebody who hasn't felt well, go ahead. We are flexible in our testing. Like example, a renowned person called us and said, I have a compound, I have a fence, because when our guys go to test, they have to wear their full PPE. He said, well, I don't want to be embarrassed, so we'll work along with you. Our team drove in the compound, he agreed the compound, got dressed and tested them. The result came 2 of his family members were positive. And we nicely escorted them and said, can my family drive me here? We say yes. Basically, these instances show that we realize the greatest thing that will drive people away will be stigma. We want to work with you within your comfort zone to protect you and protect our fellow Liberians around us. So we're doing that, we're flexible with testing. Our team will now have 6 testing teams, including the one that is at the SKD for the drive-through. I will speak briefly about what are our plans for the lockdown. Because you see the plan will be evolving. Tomorrow we'll speak more and more about the plan. Mark one from the list will say lockdown has 2 major purposes. The first purpose is to take the infection from the street to the home. And the next purpose is for people to go around to search for affected families and then isolate them in a dignified manner so that they can be treated and they can be managed. So our plan, we have major goals. We're going to finalize those goals and we're going to let you know in the coming days. But for your own safety and the safety of our families, the lockdown is more optimal if people stay home. For 2 reasons. You could be spreading without knowing and you could spread the other, but the other is that you yourself you could be at risk. The more you interact with people, the more you are at risk, given the fact that this virus spread. For the sake of you and your children and your family, it's best to stay home. This morning, as I left my compound and drove, I saw the young people in the community setting up check to make sure that who come in our community. One of our goal will be working with community, engaging communities and working with them to encourage people to stay. Don't see this as a curfew. The goal is to stay home. So we are going to do house-to-house search in the coming day. We'll let you know the details to find sick people, not to stigmatize them, to ramp up the testing. Once we detect cases, we isolate from the families. We never agree that intensively, and for us staying home, if you have to stay home, many families, what they encouraged the TV channel was there was one person selected per family. It is that one person that goes out to bar, that goes to the bank. And that person goes for the minimum amount of time and comes back to the family. Imagine the number of cases we have around the world today. Imagine the number of deaths we have. If we can inconvenience ourselves for 21 days, that we keep this in the community and we can find it, we can test and we can rule out people, it will have saved all of us, all the danger and the risks we face it. So we want to encourage you tomorrow to come with detailed step-by-step plan, how we're going to map our communities, work with local authorities, work with joint security forces, and you at the level of your home, cooperate with us, work with us, so that we can check around. You may be with somebody in the home you don't even know they are shedding. By the time you go look, the entire family is affected. I know now of a family, every day that passes, when we get a new test, that family is affected. Just from one person, we now have over 8 persons in one family. Every day we do the result within the family. You want to protect your family, you want to protect your children. So we encourage you, don't see this as a curfew. It is to make you to stay home, let somebody. We'll communicate more effectively tomorrow. We'll share with you our plans, how we want to organize this to make it more effective. As I said, the 2 new goals. People stay home, take the infection from the street, where you can either get it or give it to somebody. And 2, we now have the responsibility among us to get active cases from thousands and thousands of them from every community, every district, working with the county health team, working with different people, so that we can go from house to house and we'll find them, and then we can test. Only by testing, finding the cases. If you add the shipping for China, for South Korea, Taiwan, the country have done well to control this disease. They are still looking for the cases and testing. Thank you very much.
Thank you, Dr. Kala. So we'll proceed with Dr. Francis Kitta, the Chief Medical Officer of the Republic of Liberia. Dr. Kitta.
Good afternoon to all. And again, I want to say thanks to my boss, Dr. Olimina Jala, who has given an overview of what is happening in the community, and at the same time, playing the modeling role in trying to encourage Liberians to take care of themselves. Today, my focus will be more on the healthcare workers. Dr. Musoka Fala gave you what the present confirmed cases are today in the country. And one of the things that he mentioned, but did not finish that up because he anticipated me to say that, is that with those that have left our treatment center. Now, whenever we talk about COVID, we know that there are 5 persons that died. Now, those 5 persons did not die at the treatment center. We have not had any mortality at the treatment center, and we are keeping our fingers crossed to make sure that all those that go to the treatment center, and this is what timely diagnosis is very, very critical. And as long as you are diagnosed early, the chances of you walking out is very, very high. So we are encouraging our people to continue to get their tests done. So if you look at the 59 cases that we have, and since we have to look at case fatality, so for Liberia, our case fatality now is about 8.5, which is higher than what is being done globally. So we have to, but fortunately for us, those cases did not die, on our treatment guidelines. Now, To the healthcare workers, I again want to encourage all of the healthcare workers in Liberia to first begin to redouble their effort in triaging. Please, not every person that comes to the facility has COVID-19. Because at the end of the day, we'll be doing more harm to our people than good. We think that it is important that we begin to protect ourselves. And protecting ourselves does not take into consideration a full PPE in order to see a COVID patient. Just minimum, a mask. And the good thing about it is that Liberians are becoming so innovative, and as I look around here, I see masks that is being made locally. So we can use that because we can reuse them, and it's very, very important because when time comes, the N95 that people are using around, those are things that are very critical for healthcare workers. So the more we can keep them, the better it is when we begin to have additional cases. And we are saying additional cases because we are looking at the signs. We are looking at those that have active contact, what the possibilities are for them to come down. This is why it is important that those that are higher risk, we quickly isolate them and then begin to monitor them. So with that, we are begging healthcare workers not to use the N95 that we have in the clinic for every patient that you see. Please, let us be very mindful and read on the disease and follow the guideline as stipulated by the WHO. Again, testing is very, very critical to the care that we provide for those that are confirmed. Our people at the management unit are doing very well. We want to say a big thank you to the doctors, the nurses, the hygienists, and all those that are working at the 14 Military Hospital. We want to say a big thank you to all of the healthcare workers that are working at the various precautionary observation centers. But together, we can do it. We have done it before and we can do it. Now, the minister talked about passes, and I'm sure healthcare workers keep calling us about passes and so forth. It doesn't matter how many passes we make, it's going to be difficult. You have your license, please use your license. But at the same time, doctors, nurses, pharmacists, and you name the cadre of healthcare workers, the security are doing their job. You have to do your job. So when they ask you a simple question, please do not be aggressive to them. They are fellow Liberians. They are just doing a piece of job. Because sometimes, before the reality hits, you are already disgraced. So please, when you get to a checkpoint and a security officer asks you for your identification, please humbly present your identification. If you don't have it, please, the way you talk to someone will give some flexibility. And I'm saying this from experiences from some of our colleagues that were out of the team. And so please, I'm begging, because I have gone to about 3 different calls, and the securities explained to me what transpired. So again, it's just an appeal. Let us work along with the security. If we work along with the security together, we can get this right. Last but not the least, we are also appealing to the general public. Now that we're having community transmission, please, when you are getting out of your house, wear a mask. I'm saying this, and like I said, Liberians are innovative, and so let us use the locally produced mask. From what I've been told, it's about $100 Liberian to about $150 or $200 Liberian the most. So we check the market and see what it is, and it depends on what you want. If you have the one that is just made with just a tin cloth and so forth, with no filter in it, then it's about $100. But if the filter is in it, it goes above $100. So please, let us begin to do that. Because you will be preventing yourself from someone, or you will be preventing yourself from someone else. Again, we know that in many houses, it is very difficult to do a complete social distancing. A neighbor called me the other day and asked me and said, "Dad, you keep talking about social distancing. How can I do that in my house? My wife and I have just one room with our 5 kids. How can we distance ourselves and so forth?" And that really made me to think, how many other persons? And if you look in some houses, you realize that you may have 4, 5, 6 different families living in a house. But in spite of that, there are simple things you can do. There are ways you can position your kids. There are ways you can make sure that you yourself as parent play a major role to save the life of your kids. I always think about a friend and brother who died during the time of Ebola, the late Dr. Abraham Bobo. When Abraham Bobo was diagnosed of having Ebola, he lived in a house and spent most of his time in the house with his family. But he isolated himself and did everything he could to make sure that he did not get in contact with his family. To God be the glory. Yes, he alone died, but all of his family members are saved. So please, let us begin to work together as people. We've done it before, we can do it again. Thank you all so much.
Thank you, Dr. Kippen. All right. So as they prepare for your questions, we'll do a couple of quick housekeeping to give them a few minutes and then I'll come back. It has come to our attention that certain individuals within the various communities are placing calls to our call center, taking this issue to be funny. And so normally they will call and make funny remarks or say outrageous things to the call associates. And this is a national health emergency. This is a global pandemic. We want people to be mindful that your actions have consequences. We know that there are people trying to politicize everything. So do not call and insult the call associates, threaten them, or make funny remarks. Some of you know the kind of funny remarks I'm talking about. When a lady picks up the phone, they will say outrageous things to the lady. So we want you to be mindful, because when you're caught, you will face the law. We're not joking. We also notice that people are making their own posters and putting it around in the various communities, sort of different messaging. We also want you to be careful, because we want to be in unison with the health authorities. So if you do have the means to make posters, make sure you do it in line with the National Public Health Institute of Liberia through the pillow, the risk communication. They have a pillow called risk communications, meaning you go there, ask for Mr. Hassan Kiaru, or just ask for the risk communication office and say, I want to make this poster for my community. Can you look at the messaging on it and approve it for me? Do not just make any kind of statement there that's going to scare people away. We have the MICAT passes that have gone out to some journalists, 6 for radio stations, and 3 for you on the online platforms, 3 for the newspapers, meaning the editor and 2 reporters. Please make sure you have one of these passes to be able to operate. We're going to work closely with the joint security, and if that need be, we will change them to one that will bear some security features for you, the journalists. We appeal to you, when you meet members of the joint security team, be very cordial to them, be very respectful, present your pass with the MICAT emblem on it and that of the Minister of Information, Cultural Affairs and Tourism, as stated in the address by the President. Please be respectful. Being a journalist or a media practitioner does not put you above the law. So we're asking you to do that. We're operating with both the electronic and print media. And just like the President said, skeletal staff means that we have to give you a small little particular number of persons that will work in your entity. Okay? Now there are so many people wanting clarity from the government on certain issues. Because these people are medical practitioners and medical doctors and what have you, we will now entertain questions for them, and then we will come to provide the clarity as it relates to the President's address to the nation. There's lots of things, a few that I have to cover. I'll give you an example of one. The President declared a state of emergency for 3 weeks, which is 21 days. State of emergency is quite different from the quarantine. And then you will see how many days the quarantine is for. I will draw the line and give you the facts as opposed to the fiction. There are a couple of them facts that I have to give you today compared to the fiction that you've been hearing in the last 72 hours. So if you have a question for any of the three presenters, Dr. Kete, Dr. Jala, and Dr. Fala, we ask you to come to your microphone. They will take notes, and one at a time, they will address your questions. If you don't have questions, that's okay. It means they were clear, they were loud and clear and precise and mostly articulate. And please state your name for the record, and then tell us who you are addressing your question to so the person can take a little note. Thank you.
My name is Professor from KMTV. My question goes to the Health Minister. We are in rainy season, and we know the rainy season comes with cold and cough. So, and then we have a symptom of coronavirus, like cold and cough. How can we distinguish that? That is normal cold or is a symptom of coronavirus?
Thank you, Minister. My name is Arthur B. and I report for OPF. I have three concerns, but Minister, my first concern is Dr. Fala. With the situation of those who died of the virus, I'd like to understand from you, do we have a serious site being identified for those being buried as a result of falling prey to the virus? What's the safety of that environment and specifically? Another concern is, we in a health crisis, is there a continuation of normal health supplies to health facilities across the country as we speak to attend to illnesses or situations that are not of coronavirus?
And what that one is for? The second question was for?
The Minister. The second question to the Minister is the situation of transportation for some of those health workers, because we noticed about 3 o'clock the whole street is cleared off. So what mechanisms are you putting in place to make sure that after 3, 4, 5, some of the health workers who try to make their way home can be find access to get home? Thank you, sir.
Thank you very much. My name is Elijah Diaz-Pine, and I work for the West Africa Info Post BG. My question has to do with state. I would love to address it to the State Security Board. I don't see any of them speaking here today. So it be addressed directly to the Minister. So Minister, my question has to do with what some mechanisms you are putting in place in order to save the lives of the state security as well. Because we see they are vulnerable, they don't have those masks, they don't even have a hand sanitizer in order to control the spread of this virus, the one itself. And they always moving in group, even in a pickup or on bike. 3 person, 4 person on bike. Good afternoon, I'm Trocon Farmer and I report for Fabric. I have a concern here to Dr. Masoka Fala. During the preparatory stage of this entire fight against the virus, you requested 60 million to enable you, have a good system to fight the virus. Now that we have an increasing wave of the virus in the country and the confirmed cases are going up every time, do you still maintain the 60 million, or is there a need for more funding to come to your institution to fight this? And my second concern is misinformation during the Ebola crisis. One of the issues, one of the things which our people were not aware of was misinformation. Misinformation led them to do a lot of things that led to a lot of people to die during the Ebola crisis. Now we are observing the same thing for coronavirus in the country, where people will go in the community and say they are spraying the community and they are going to do this. So what specific budget do you have for media, and what are those media entities captured to tell the public that these entities are responsible to disseminate specifically coronavirus information, so we cannot have a repetition of what happened during the Ebola crisis?
My name is Renzi Estivia, and I report for the online newspaper. My question goes directly to Minister of Account, which is the Ministry of Information. After President Weah pronounced the state of emergency, I decided to tour in the various market area, more especially stores and various markets. Now, I learned that there's people selling goods, using this means to be able to exploit the Liberian people. Now, we're talking about people staying home. Can you imagine this morning when I went to Uru market and other market, less important consumer goods like aquarium, the buckets now they being sold for almost $500. So if you're telling people to stay home, I want to know why the Ministry of Commerce are paying attention to the issues that they make sure that the prices, everything are controlling in order for the people to get food for themselves. Thank you so much.
My name is Ibrahim Sharif, and I report for the Liberia News Agency. I have 2 concerns here. It goes to the Deputy Minister of Public Affairs. Concern number 1. Yesterday, during our tour, we find out that there are many less privileged Liberians who are finding it difficult to get their ends meet. So, is there any plan by the government to address the nutritional needs of those less fortunate Liberians? And the second concern, yesterday we noticed that there were commotion between security officers and that of journalists. Is there any plan to address that?
Minister. So I'll start with the last one. Thank you, Abraham. Let's start off first. If there's any plan to address any form of altercation with media, between media personnel and that of the joint security. And that is exactly why I stated in my comments here that indeed the media should try to cooperate with the joint security. Even the great United States of America, obtaining a visa here in Monrovia does not automatically grant you the right to enter the United States. So by virtue of the fact that we gave you a pass, does not mean you can go through a security checkpoint unchecked or pass by some members of the joint security untouched. So if you are requested to present your pass, I think you heard Dr. Kittel talking about healthcare workers, if you are asked to present your pass, and you do, and the security officer is still not satisfied, they will contact us immediately for verification. So again, that mechanism is in place, that we've given you a pass as the president promised. And so you have the passes. But it does not mean that you can just ride through a security checkpoint or go to cover an event and be questioned and not answer the member of the joint security that is questioning you. And if asked to present your pass, it is your patriotic duty to do so. Because even the pass that we gave you, I'm wearing one myself. It can be duplicated. Criminals can get your pass and use it for criminal activities. So again, what if the name on your pass does not match the name on your ID card? What happens? So I appeal to you to cooperate with members of the joint security. As far as addressing the needs of the less fortunate, the government have begun to do that. There's no plan to do that because the government is doing that presently as we speak. You can check with the various groups to verify this information. On the other issue of what is in place for health workers' transportation, the reason why I'm not going to let Dr. Fowler answer that question is like putting too much on him. This is the government. I think a fortnight ago, about 2 days ago, I took a ride around the city, and during the ride, we were able to prove beyond all reasonable doubt that NTA buses, you can see at the back of the bus, for health workers only. So transportation is there for health workers. Once you show your ID or your license, you're picked up by the NTA bus and on your route to work. No questions to that. The other question with respect to state security safety, that they're not wearing masks, that they don't have hand sanitizers. Well, indeed, some of them don't. I know the one that hangs around with me does. But again, even the people out there, we want to encourage them to wear masks. How many Liberian citizens you see in the street with masks? And that is why a lockdown or a quarantine, I like to call it like this, should be adhered to. So the state security will not be in as much danger if citizens will obey the law by staying inside. That way they don't have to come across each other. But government is doing everything within this power to make sure that every security officer is safe in the line of duty. They have the media entity, the budget, and specific media entities captured in the budget. I know you're a journalist, but I also know that media is money, the M2M. We are not in the business of needing media entities that have a contract with government. That's not what we want to do. We're not going to tell you what Mr. X makes at this media entity and what Mr. Y makes. However, there is a budget for media, and that budget is being expanded as we go along. I can see KMTV the other day, I see LMTV, I see other people, but at the same time while sitting here about 3 minutes ago, I was also monitoring a senator having a press conference. So again, there's a difference there. There are other people covering this place, there are other people on the other side. So those that work in line with COVID's response team will be beneficiaries of the budget set aside for media purposes. On the issue of the marketplaces and the prices, the demand for any commodity will bring about the rising price of that commodity. So because there is a quarantine going on, there will be some form of price anxiety or consumer anxiety either ways. Because if you, the consumer, keep rushing for the bucket of farina, then the woman who's selling it will say, but many people have for my booze. So she will make the price high. And I don't think we should be doing that at this time either ways. But it is what it is. And as far as the Ministry of Commerce is concerned, they're doing everything possible to make sure that people do not take advantage of the consumers or subject them to some form of predatory consumption where they just prey on the consumers because of the situation. So I hope all of the questions were touched. relative to the government. And we will now call Dr. Wilhelmina Jala to take her question, followed by Dr. Masuka Fala. And like I said, I will provide the 3 or 4 most important clarity that the Liberian people have been demanding over the last 48 to 72 hours.
Okay, so people are concerned about the rainy season coming and about cold and cough. Now, some of the major symptoms of COVID-19: fever, tiredness, dry cough, difficulty breathing. So if you have a cold or a cough and it's not going away, you have drank all the medicine that you know how to drink, and you are going to all the different pharmacies and bought all the different things, and it's not working, just go to the drive-through center and let them test you. It doesn't hurt. So even with the rainy season coming in, we expect that people will still go, because you will notice that you will be extra tired. In a regular cold and cough, you are not extra tired. Your cough is not dry. Sometimes you don't have sore throat. Sometimes you will not have difficulty breathing. So you will know the difference between a regular cold and cough that you may having many times, from if you are not feeling well generally, in spite of all the medication that you will be taking. So you will know if you are not well with COVID-19, you will know you will feel different. Even though I don't know, but I'm sure those who have come down with real COVID-19 feel a little bit different from their normal self. So if you are feeling different and you are coughing and you have a cold and that cough is dry, your throat is sore, your mouth is bitter, because it says COVID-19, you will lose the taste and smell. So you might not taste anything that you eat, or when you smell, you're not smelling anything. That's an additional symptom that you should be looking for if you have COVID-19. Your head might be heavy, or your nose might be stuffy. All of those things tell you that it's not your common cold. So please, when you're having any of those things, just show up to the testing center. A few minutes, they will take your sample, and then you will take your information. If it's positive, that means you need to isolate yourself from other people so you are not spreading COVID-19. Healthcare worker on the line, the healthcare worker we did, and we're still working with MTA to make sure there are buses available, where we are requesting that healthcare workers, if you have your own mask, bring it with you. If not, we might be able to give masks, but everybody that will be on those buses have to travel with a mask, just so that we can make sure that healthcare workers get to the different facilities and be able to work, and we can take them back home safely. This is some of the things that we are trying to do to have our normal routine services continue. We have done our distribution to the facilities. We are completing in some areas to make sure at least the basic supplies are there, while we add up with other protective gears for the people at the different facilities. This is ongoing, so we'll make sure that people have what they need to be able to work with, in order to make sure that both routine services and COVID is working together. We want to try to keep those who have COVID-19 out of our regular health facilities. We want to make sure that's why we encourage you. If you are positive, we will take you to the 14 military hospital, or we have other places that you can be isolated. We don't want all the hospitals to be full with COVID-19 patients, then there will be nowhere for people who have other conditions, malaria, typhoid, or they have to go for operation, they have to go for delivery. We want those other hospitals to be safe so that you can go there, and we monitor those who have COVID-19 in the special areas that we have set up. Thank you.
Dr. Fala?
Issue of special burial site and 60 million, which are very wondering. So unlike Ebola, the reason why we're so particular about Ebola death confirming a site very long was that Ebola, upon death, the person ballistic become infectious. Nevertheless, what we are encouraging and we have been doing is that once there is a death, a community death, we test to make sure. The reason we are testing is that to develop the contact before that let the persons that it was COVID, then we have to find the contact, actually the high-risk contact. The next thing we tend to do is to put the body in the body bed, seal it up, and then people can do normal burial. Worst case, we have the disco, one of the, like I said, Ebola, that we bury somebody Ebola there, we have the disco, but we encourage people who can beg the body. Where we find it to have a burial, beg the body for you before you casket and burial. The key is to test the body, all dead bodies, second, beg it up, and then you can have a casket with burial. When we started preparing fees, we had asked for $3 million. 1.5 were asking for the government, and 1.5 from our partner. Now that we're in response phase, and some countries are in preparedness phase, we have a one government project that includes preparedness, response, and recovery. All do know we have shut down institutions. Some institutions are used as sector for quarantine. There will be a need for recovery. The current testing now are 45 million. Now taking into consideration the preparedness part, our response and trying to build recovery after this, making our health system better to be able to respond. That's what the current budget stands right now. With the initial 750 to 1.5 million from the Liberal government. The government has sent 750,000 of the 1.5, and then in the process of sending the remaining 750,000 with our initial 1.5 million from the World Bank, and a commitment for a 6.5 million of the account. Those are the amounts that we are expecting. There have been a lot of contribution by the private sector, the banks. I know we checked that the cycle accounts around 220,000 in our account. But just to answer your question in simple terms, the current package stands at 45 million for preparedness, response, and recovery to make the country more resilient after the outbreak. Again, thank you very much. The best way is to test and isolate. If you stay home and we can test, if you're not in the symptom, we all be able to overcome this nightmare. Thank you very much.
Keta?
Will I Dr. Keta takes it?
Did you have any questions? No. Okay. So basically, the public have been wanting some form of clarity with respect to the address. A lot of people have been saying, I'm confused, I don't know what is this, I don't know how many days we're quarantined for, how many hours we're supposed to be outside, are we supposed to be outside from in the morning till 3 o'clock? Basically, I'm here to answer that question for you. Let us begin with, first of all, everybody say, will we be outside for 21 days? It is clear, and I'm going to quote the President of the Republic of Liberia directly. Quote, I further announce under the state of emergency that all 15 counties in the Republic of Liberia are hereby quarantined from 11:59 p.m. on Friday, April 10, 2020, until further notice. I hope we got that clear. The quarantine started from Friday, April 10, 2020, until further notice. So there are friends that are playing politics. They're saying that, oh, the quarantine is for 3 weeks. I know sometimes reading with comprehension can be difficult for some people, but it's our duty, our statutory mandate, to provide the clarity. And let me state for the record that the President, in his address, said, and I quote, with respect to this 3 weeks thing now, therefore, I'm quoting the President, quote, therefore, by the authority granted to me under Article 85, 86, 87, and 88 of the Liberian Constitution, and after due consultation with the Speaker of the House of Representatives and the President pro tempore of the Liberian Senate as required by law, I, George Manawia, President of the Republic of Liberia, hereby declare a state of emergency to exist in and throughout the Republic of Liberia for a period of 3 weeks, renewable until the threat to Liberia from the COVID-19 virus no longer exists, unquote. So the state of emergency is declared for 3 weeks. Now, you say, okay, what is the state of emergency? The state of emergency is a situation of national disaster or danger in which the government suspends normal constitutional procedures, if you like. All right? That's how we will define it. But where the government sets aside the Constitution for a short period to confront the danger or disaster that have come upon the country until they can gain full control of the situation. So I have quoted for you from the President's address, which I have here, that a state of emergency was declared for what? 3 weeks. That's the period of the state of emergency. When it comes to the time of this whole quarantine, I have quoted for you again, and I would like to repeat it. I further announce under the state of emergency that all 15 counties in the Republic of Liberia are hereby quarantined from 11:59 p.m. on Friday, April 10, 2020 until further notice, period, unquote. So this quarantine is in full effect until further notice. It's also important for the record that I provide this clarity again to the Liberian people. Quote from the President again, movement between counties are strictly prohibited. What that means, moving from one county to the other county is strictly prohibited. And there are 2 counties, Montserrat and Magidi, are 2 different counties, 2 separate counties, but in this case, under the state of emergency, they will be treated as a single unit. Meaning people can move from Magidi into Montserrat into Magidi, because they are quarantined as a single unit. I'm going to quote the President to provide clarity on something that many persons are not understanding. We have 15 counties, but 4 counties were plucked out of the 15 and given strict instructions by the President. I'm going to quote, as a further measure, under the state of emergency, all Liberians and residents within the borders of Montserrat County, Magidi County, Nipa County, and Granville County are to stay home for the next 14 days, beginning at 11:59 p.m. on Friday, April 10, 2020, period, unquote. What is there to clarify? They need 4 specific counties. That the people in those counties are to stay home. Again, when people are out in the morning, we understand the situation. They're not encouraging social distancing. That is a challenge. The president was very clear. Even in the president's address, to show you how serious it was, if you look here, you will see the stay home address in bold, big capital letters for a period of 14 days. While it's true that the quarantine is in effect until further order, but the people in these 4 counties are to stay home for 14 days, beginning last Friday. Again, I'd like to make a clarity. For people who leave, you're supposed to stay within your community if you're looking for food. We are seeing people leaving their place, going way across the bridge. Even if you leave your community, your house, and stay within your community, it should be for 1 hour. So why are you leaving your community, VOA, and going all the way to Guadalajara? The last clarity I'd like to provide is on the part of the exceptions, where many persons are getting confused. I'm going to quote the president here. Quote, exceptions shall be made for persons who are designated as essential staff in government offices, banks, supermarkets, and other business establishments, such as hotels, petrol stations, what we call gas stations, and health facilities. To travel directly to work and return directly home. All such commercial activities are to be closed no later than 3 p.m. So clearly, they made exceptions for people working in banks, petrol stations, health facilities, to be able to go directly to work and go directly back home. That's the exception. What we see where people are getting confused is, and I want people to listen, quoting the president, all non-essential businesses and government offices, all non-essential businesses and government offices will remain closed. All non-essential businesses and government offices will remain closed, period, unquote. Now, there is an exception there. And so we're going to quote the exceptions so that you members of the media pick it up so people cannot get confused any further than they have gotten confused in recent time. Quote, all non-essential businesses and government offices will remain closed with the exception, here is the exception, with the exception of essential businesses, health facilities, and few key government offices, such as the Ministry of Finance, the Ministry of Foreign Affairs, the Central Bank of Liberia, the National Port Authority, Liberian Revenue Authority, the Monrovia City Corporation, the Liberian Broadcasting System, and accredited media, where only a skeleton staff will be given passes to work. Where only a skeleton staff will be given passes to work. What does that mean? You heard the exception. If you are in foreign affairs, Ministry of Finance, and those places, yes, it's true you are exempt. But liaise with your management and find out whether you are an essential staff or not. Because only a skeletal staff will be given passes to work. And those passes will be to go to work and to go directly home. I quoted that for you. Go to work and go directly home. It is clear that the president made it clear that we will be given passes to go to work and directly home. Now, if you have any questions with regards to clarity, we'll take that in the next meeting due to time. But we have an announcement here from the newly appointed head of the COVID-19 response mechanism by the President, Honorable Mary Brock, that we would like to, I'm sure, rather have this distributed it to members of the media, and the dissemination is ongoing, but we just want to make sure that the public hear it from us directly. So I'm going to do this real quick. It's going to be difficult to read from my phone, so please bear with me. By the power vested in me as COVID-19 National Response Coordinator by the President, I don't want to go through all of that, but the following individuals and officials of government have been appointed by Honorable Brock on the following pillars: the COVID response team, and that is the coordination of the COVID response team is going to be handled now by Dr. Wilhelmina Jala as the chairperson, and Dr. Francis Kete as the co-chairperson. For the EPI surveillance, we're going to have Mr. Luke Bauer, National Coordinator, Health Management Information and Research, Ministry of Health. We're going to have contact tracing, Honorable Sanford Wisa, Assistant Minister of Vital Statistics. We're going to have for case management, Dr. Jerry Brown, Chief Executive Officer and Administrator, the JFK Medical Center. We have for infection and prevention control, Dr. Samuel Azokwe. Sorry if I pronounced it wrong. We're going to have for laboratory, Mr. Fan Tower, and for risk communication, Honorable Len Eugene Nombe. For the logistics and supplies, Honorable Mary T. Brock, Director of GSA herself, will handle that, logistics and supplies. For case investigation, Mr. Thomas Nambe, who is the Assistant Director General of NPHIL. We're going to have for psychosocial counseling, the Minister of Gender, Honorable Piso Selita. We're going to have for the post of entry, the Commissioner of Immigration, Commissioner Robert Bully. And for the WASH Commission, we're going to have Mr. Bobby Whitfield. And for dead body management, Honorable Vani Sali of the Ministry of Internal Affairs. Further appointments to the response include for community coordination, or it's not clear, but we're going to have Honorable Vani Sari in charge of that, community, and then we're going to have the sanitation and hygiene. We're going to have Honorable Jefferson T. Koji, the mayor of the city of Monrovia, and also we're going to have for women, girls, and children, we're going to have Honorable Piso Tai in charge of that through the response, as well as for food, nutrition, and security, as well as livelihood. We're going to have our new agricultural minister, Honorable Jenny M. Cooper, and then we also have for youth and vulnerable groups, and that is disaffected youth, physically challenged individuals. We're going to have Honorable D. Zilda Wilson, the Minister of Youth and Sports. And for public awareness, we're going to have Honorable Lane Eugene Langway. It's with the Deputy Director for Press, Director Robert Haynes, so you can grab you a safe copy of those appointments for COVID response activities. With that said, ladies and gentlemen of the press, and all of those people in Radio Land that have been so patient with us and cooperating, we want to say thank you all for today. We look forward to seeing you on Thursday at about 12 p.m. We're sorry for the delay due to traffic congestion out there, but please be safe, wash your hands. We encourage social distancing as well as trying to keep the rule of law alive.
And so this is how we come to the end of today's press briefing. Thank for your many comments. Thank for your viewership. Stay safe. Don't shake hands. From the side of KMTV, my name is Godfrey Pedokwanza. Bye-bye for now.